Hey, and welcome to another episode of Understanding CBD. Today, I'm your host, Stephen Wallman from Wallman's Apothecary. And our topic today is cannabis as medicine, what clinicians need to know. And in this video, we're talking with Renee Reisinger. She's a nurse practitioner, also a graduate of the University of Maryland School of Pharmacy with a master's degree. And we'll be discussing everything clinicians need to know from science of cannabis and how it operates, different types of cannabis. So with no further ado, I will bring in Renee Reisinger. Hey, Renee.
Hi, how are you?
I'm great. How are you doing?
Good.
Good. Well, I was just mentioning in your introduction how you're a graduate of the University of Maryland School of Pharmacy with a master's in cannabis, which many people don't know even exists. And there was a new graduating class yesterday. Is that right?
Correct, yes.
And did you attend the graduation?
I was fortunate to attend the in-person graduation. It was exciting, and it was very, refreshing to be in a group of people that were all on the same page with promoting cannabis as medicine.
That's really cool. Did you have any connection to that class specifically? Do you know any of the graduates?
Yes, I know the graduates, the professors, and as one of the professors said, once you graduate, you never really leave. You're part of the family. We want to hear from you, hear what you're doing, hear what you're changing out there in the world to help make plant cannabis more accessible to people.
That's beautiful. And, because in the cannabis space, when you either work in it or you're helping people with cannabis, we tend to get into a bubble almost, and we talk to each other more than we talk to other people, which is really one of the main reasons why we collaborate on this podcast, is to get this information out onto the social platforms so people can share it. And you really don't know who it's going to reach. And our hope is that people share it to those people that need it. And with the experience you have as a clinician, both without cannabis and with cannabis, I think your perspective is really, really important to share and give people context of the way cannabis can play a role in wellness. And I'd like to start out today to talk a little bit about cannabis as medicine and talk a little bit about the science behind cannabis and how it works in the body. Can you help share some of that information to start?
Yeah, so I think most of us know cannabis has been used for thousands of years for various reasons. For medicine, it's been used in religious, endeavors. It's been used as food. It's been used for recreation. Cannabis has been illegal in the U.S. For decades now. So when we talk about cannabis and educating people about cannabis use, we're talking about re-educating people about a previously used, high benefit, some risk medication.
I'm so glad you brought that up, because it's often considered this novel industry and this new product that no one has experience with. And maybe in our lifetime, it is new. But before that, it has quite a history. Can you share maybe a couple tidbits of how it was used historically as medicine?
It was part of in the previous decade. It was part of the U.S. pharmacopoeia, and it was presented in tinctures, and then and it was often used for pain control, other treatment modalities that didn't have any other pharmaceutical benefit or any other pharmaceutical available, like seizures. And then as time went by and the opioid industry became more prevalent and opioids were available, then cannabis kind of got pushed to the side. And then eventually, it became illegal in the U.S. And then as it started to reemerge in California, in San Francisco, around the beginning of the HIV epidemic, people in the community were realizing, that cannabis had benefits as an appetite stimulant. And some very brave physicians got involved in trying to promote cannabis for patient comfort and patient needs. And that was the beginning of the formation of the Society of Cannabis Clinicians. You have to forgive my Baltimore accent when I try to pronounce some of these names. But the doctor that initially found it was the founder of the SCC, Dr. Todd McCorea, was touted by his colleagues as a historian, a physician, an educator, an organizer, a researcher, a citizen, and a friend. And when the Society of Cannabis Clinicians first started, it was started in California, and I believe before it was the Society of Cannabis Clinicians, it was specific just to California. And as time went by, and it wanted to expand, then it changed from just California to the Society of the Cannabis Clinicians, and then it went on to become a nonprofit organization, and it's really, I think, the lead organization in the U.S. for clinicians, for education, research, advocacy, and promoting the right of providers to be able to discuss cannabis as medicine with their patients, which also becomes an issue in some places.
Yes, yes. Well, thanks for bringing that up, because I know it's important to acknowledge those that paved the pathway for us even to be here talking about and being able to use cannabis legally. Now, when you're speaking with clinicians that aren't familiar with cannabis, or you're speaking to a patient that wants to use cannabis for the first time, a lot of times people, even though they don't ask, how does Tylenol work or how does Advil work? They want to know how cannabis works in the body. Can you share some insight into how cannabis works in the body?
So scientists discovered the human endocannabinoid system in a couple decades ago, and it's really not taught in most of our medical nursing schools of pharmacy. Most of our health institutions aren't yet teaching about this, which needs to be moved forward. So the human endocannabinoid system, I think, as we discussed last time, is the master regulator of every other system in our body. Scientists are always discovering more treasures about cannabis and the endocannabinoid system. We do know there's a CB1, CB2 receptor. We do know that there's two internal or endogenous cannabinoids, anandamide and 2-AG, which are respectively similar to THC and CBD. So our body produces two internal cannabinoids, and the hypothesis is that when we don't feel well, when we have illness, injury, disease symptoms, that our body's in an endocannabinoid deficit, and we're looking to plant cannabis to help restore us to health and wellness. Other modalities are diet, exercise, stress reduction, meditation. There are other foods and other herbs that also can help boost our endocannabinoid system. So I think it's important for patients and providers to constantly be educating ourselves about how to help us feel better. To focus on wellness, and as providers also to keep ourselves, abreast of what's happening with Western medicine.
Yeah, that's really important. I think the way you present it also puts a realistic spin on it, because it's not presented as cannabis is going to heal you and solve all your problems. You present it as another tool in the toolbox that people should be able to have access to and try in order to help whatever challenges that they're having, whether it's mental or physical. So that's really, really helpful, Renee, and thanks for pointing that out. So the other part that I wanted to cover, and at least you can help identify with, which is what types of cannabis are out there. So when people want to purchase cannabis, what are their choices?
So I think, as you know, the words that we use are important in so many ways. Typically, when we hear about medical cannabis, people talk about sativas and indicas. And in the past, the sativa and the indica may have been more separate. But as time has gone by, I think in the medical cannabis industry, for medical patients, we're seeing more hybrid indica sativas. And people in the industry are trying to move to a name or a nomenclature of type 1, type 2, type 3. Type 1 is high in THC. Type 3 is high in CBD, and type 2 is a mixture of both, or a middle of the road.
Thank you for saying that, Renee. And this has been one of my issues since the medical program, at least in Maryland, has started. And it's the positioning of indica and sativa, one being more sedative and one being more energy boosting. And they use the terpenes in a way to qualify or categorize the way you're going to react to a certain variety of cannabis that you purchase. And it really couldn't be further from the truth. I was growing years ago, and when we would select seeds, we would select a seed, whether it's indica or sativa, based on the growing environment and its likelihood to thrive, whether it was going to be large or small. Really didn't have any therapeutic benefit in the conversation at all. So I was a little surprised when people started using indica and sativa as a method for determining which cannabis was medicinal or not, because I always believed what you're saying and what the U.S. Pharmacopoeia said back in the 1930s was the three types of cannabis. You have high CBD, high THC, or type 2, which is the one in the middle. So thank you very much. And I know there is going to be people that don't agree or don't want to hear that story or don't agree with it, but it's one of those things that over time we'll start to see come back into the reality. Now, the terpenes aren't something that we talk about often. We a lot of times are talking about the high CBD or THC. Now, we also hear this term terpenes. And what role do they play, if any, in this cannabis as medicine?
So plant medicine is different than Western pharmacology products in that we're talking about a plant. So the female marijuana flower has the healing properties of medical cannabis. The sticky stuff on the outside of that plant are terpenes. When people smoke it, it's typically what gives it the skunky aroma. Different terpenes and different cannabinoids work differently for different people. So terpenes are important. Maryland has a nice medical program, I think, that could be a model for other states, because every product that you buy at a medical cannabis dispensary in Maryland will list terpenes and cannabinoids, and that's helpful for patients because that allows them to add science into discovering what product they want. I think the reality too is for people, once they find a type of cannabis that works for them, I hear a lot of people say it's hard to find that type again. I know there are people in the industry, Tetragram app with Otha Smith, who is trying to correlate data and help people find where they can go for those specific types of cannabis with terpenes and cannabinoids. And then I know in the past I had talked very strongly about journaling your cannabis use to try to find what works best. Recently, one of the new graduates from the School of Pharmacy, a veteran, Sharessa Jackson, has a WeDecode.me where you can do a saliva test and genetically test what diseases you're predisposed to, and it can zero in on what terpenes and cannabinoids you would need. And the two of them are working together. I think they're going to come out with some strong science to help take away the guesswork, the journaling, the where can I find this type that helped me last time. Like if you know what type of terpene and cannabinoid you need, and then you know where to go get it, that will, I think, be incredibly helpful, to patients and providers.
Yeah, that's really good. And everyone has a strong opinion on this and how it weighs into the medicinal properties of cannabis. And I love all the different opinions that everyone has. And I'd love to hear more. If you do have any, please put some in the comments, whether you're listening live or watching the replay, because we do monitor these and we want to hear what your opinion is. I'm happy to share my opinion, and whether anyone wants to hear it or not. But I believe that cannabis has been a camp follower of humans for tens of thousands of years, and similar to honey, where local honey works best for you, I do feel that the cannabis plant grown as close to you as possible and consumed in a way that's as whole plant as possible has the highest likelihood of getting results for you. That could be completely my opinion. As a manufacturer of of CBD products, type 3 cannabis, where we focus on high CBD because it's currently federally legal. And growing our plants and comparing all the different manufacturers in the industry, the most don't do terpene reports. And I think a lot of that has to do with quality. So once the plants are harvested, the terpenes go away quicker because they're lighter compounds. So what I look for is a cannabis variety that would be either type 1, type 2, or type 3, whichever would match with whatever conditions you're facing, but looking for something that's grown as naturally as possible without pesticides and fungicides. If you can get cannabis that's grown in the sun and in soil, I believe that has an impact on the therapeutic properties. I also think that there's another question that we can talk about, and we haven't talked about this before, but it's happening right now in Maryland. So patients have to make this decision. There's a medical cannabis program, and then there's an adult use cannabis program. So what's the difference in your mind, the difference between medical cannabis and just recreation or adult use cannabis? Is there a clear differentiation there, or how do you reconcile this?
So, Maryland rolled out a very strong medical cannabis program, and it hopefully, should carry over into recreational. So that's a good question. I know, I believe recreational is going to be available July 1st. I know it was a huge bill. There was a lot of work that went into it. And I know from having listened to one of the delegates speak, they know that there are going to be amendments that need to be made. And I think we need to remember also with recreational, it's only available for age 21 and over. And we do have a lot of under 21-year-old people in Maryland that use the medical cannabis and that need cannabis as medicine. So what we want to see for our medical users is we want to see our medical users protected with having access to the high quality cannabis that they've always had access to.
Yeah,
and
go ahead. That's important to bring up that it's one important part for the medical cannabis program, and not just Maryland and other states, is if you're under 21, the recreational cannabis for the most part is treated similar to alcohol, where you have to be 21 in order to consume or purchase. And for those patients that are under 21, it's good to know that there is a medical program that you can get a card or a caretaker that can help people that are under 21. So that's really important. To take a little spin back here, back to the clinical side of cannabis and the research side, because we get a lot of questions from people clinically of what research is there and where do I go to find, because I know there's a lot of research, but where would a clinician go to find good research studies that are credible on cannabis used as medicine? Like what types of conditions and how is it used? Does such a source even exist?
Yes, the sources are there. So one of my favorite, nonprofit sites to promote is the Society of Cannabis Clinicians. And the Society of Cannabis Clinicians has a research library that people can access. And also, they have just come out with a 5-module, what they want to be the healthcare provider industry standard for certification as a cannabis expert, or not an expert, somebody certified in cannabis medicine as a provider. A lot of our specialty groups, they'll have a certification. So the Society of Cannabis Clinicians has rolled out what they want to start as a cannabinoid medicine certification. There still is no official certification, but this is the beginning. So as a clinician, I would encourage other clinicians to get on the website, look at the modules, and consider moving forward with getting that 5-module certification. There's always more to learn about cannabis. I graduated 2 years ago, and I find, with everything in medicine, there's so much information always coming out. I need to keep up and try to, read, sources every day to see what's coming out, that's new with Western medicine and with cannabis.
Yeah, it's important to integrate the two because we sometimes need the two. There's a lot of value to be obtained from both, and looking at patients holistically and thinking of quality of life is really a good context to put into this conversation. So when we're talking about conditions and when would someone look to cannabis, do any things jump out in you as say, hey, if someone has presenting with these sort of conditions, or if they're currently struggling with certain medications, is there any things that jump out in your mind, like, hey, this should be one of the top things that you should consider cannabis for?
So anytime, a clinician is engaging with a patient, they always want to listen to the patient, their chief complaint, what medicines are you using, history, surgical history, medical history. And then, the question, how may I help you? And let the patient let you know what their healthcare goals are. And then as an educated clinician, then you can present the information, educate the patient on different choices, and help them make the best decision. We call that shared decision making. And part of shared decision making is, keeping yourself up to date on, updated clinical guidelines, what's new, what's not safe, what's the research saying. You need, as a clinician, you need to constantly do your due diligence so you can do the best job for your patient.
Yeah, yeah, and for me, the thing that I hear, I would say, almost every day, is the patients or customers of ours or clients that call that are struggling because they're taking pain medications, and their fear of the side effects of opioids, whether it's the addiction, the side effects, the drowsiness, and then, as we know, the the suicide rate that comes along with opioid addiction and relationships and so forth. Is there any evidence or information about the impact of cannabis on the use of opioids?
Yes, there's a lot of information out there. And back in, I think it was the winter of 2018-19 in O'Shaughnessy, Dr. Dustin Sulak posted an article, Cannabis Enables Pain Patients to Cut Opioid Use. Availability would reduce ER visits and overdose deaths. And this was published in the winter of 2018-19. It's an excellent article. So like I said, there's a lot of information out there.
This That's came 2018, 2019.
Yeah, winter. Yes, this came from the Society of Cannabis Clinicians.
That's great. So this isn't new information.
No, sir, this isn't new information.
Yeah. So if you're a clinician and you're helping patients, we've given you some good resources. We'll put some in the comments as well. And Renee, we'll hopefully be back to have more conversations with us to help share more insights and just to keep supporting this conversation, right?
Yes. May I name two more sources that I
Absolutely.
like?
Absolutely. Yeah.
So it was the International Association of Cannabinoid Medicine. I think they recently changed to International Alliance of Cannabinoid Medicine. It's an international group like this, similar to the Society of Cannabis Clinicians, which is expanding, I think, internationally now. And then another resource that I like is Cannabis. They compile research from these two groups and all over the world and try to make it easier for clinicians to understand the information. So I think they're actually, maybe they'll be coming out with some clinical guidelines soon. I know when I first started as a new nurse practitioner, I always tried to stay in those clinical guidelines to practice safely. And like I said, cannabis isn't new, but it's new to us because we haven't learned about it before. And then one of the physicians that also spoke today, not today, but spoke at the Society of Cannabis webinar in the history, Dr. Jeff Hergenrather, his ending thought was that state-supported health universities should be teaching cannabis as medicine and the endocannabinoid system. And University of Maryland School of Pharmacy is, and hopefully other universities will follow. But if they aren't willing to do this, then I think, or what he also said was that, it needs to be mandated. It needs to be legislated to happen. And I know I said before, I think, if you're not going to self-educate, that perhaps it needs to be tied to your recertification. Just a thought.
Hey, it's just a thought. It's a good thought. And, this is all in the guise of helping each other, through tough times. We know that everyone's struggling in the world. Not that isn't always been the case, but now we have an opportunity to help each other use this information that's been out there and really use it for good. And that's, I think, a great story and a message for today, Renee. So thanks so much for joining us
Thank you.
on TV today. And we'll definitely have you back for another conversation. And thanks, everybody, for joining. And we will talk with you soon. And if you like this information, please like it and share it as far as you can